Hi, class. This is Dr. Weaver, and I am going to have a discussion with you about, or a continued discussion with you about care of patients with problems of HIV disease. Um, the first portion of this discussion will be done live, but I wanted to continue the collaborative problems for these patients with a voiceover because I need to be able to get to tuberculosis as well. So I felt like just doing a voiceover on this particular part would help us to get through most of the information that we need to get to. This is chapter 19. So let's go ahead and start. These are the priority collaborative problems for patients with AIDS, and relevant data will be discussed in subsequent slides. So the first one we will be talking about is potential for infection, and then inadequate gas exchange, pain, inadequate nutrition, diarrhea, potential for reduced tissue integrity, cognitive decline, and potential for psychosocial distress. The important thing to remember about these particular priority issues is that the author of this textbook noted that these are some of the most significant issues that impacts these patients with HIV disease. We will be discussing how to properly manage these different problems or issues that these patients will encounter in this the disease process. Excuse me. Let's see. All right, so here we're talking about preventing infection, and how do we do this? We do it by and large, we do it by drug therapy. So you have these different combination of drugs. We have the NNRTIs or non-nucleotide reverse transcriptase. We have inhibitors. We have the NRTIs, which is the nucleoside reverse transcriptase inhibitors. And we also have the PIs or protease inhibitors as well. Take a look at page 351, chart 19-4. For information, the healthcare provider should be teaching, we as healthcare clinicians should be teaching patients in order to avoid or help avoid infections. And also chart 19-5 for hospitalized patients, how to avoid infection as well. As we know, hand washing would be one of the greatest interventions that we can do to avoid infection. Now, multiple drugs are used together in combination, and this is what we call combination antiretroviral therapy, or lowercase c and uppercase ART, or CART. And this is done to avoid drug resistance and also to improve the patient's lifespan. Now, antiretroviral drugs inhibits viral replication. All right, it does not kill the HIV virus, but it lowers the replication of the HIV virus. So antiretroviral drug combinations, they decrease the viral load that I would have discussed in the live class. And what happens is once we can lower the viral load, then you don't have enough of this virus affecting or infecting the host cells. So what this does is it improves the CD4 T cell counts. So the higher the T cell counts increase, the better the patient is able to fight or ward off certain diseases, infectious diseases. So increasing or improving the CD4 of these immune cells, it does slow the progression of this disease. So in effect, we must instruct these patients that they must take their medications of this combination therapy um, at least 90% of the time in order to avoid resistance to the drug. An important issue with CART therapy is drug-resistant mutation. And what happened? The reason why, or what happens when the virus becomes resistant to HIV drugs? Viral replication or the ability for this virus to replicate is no longer suppressed by these drugs, and this is not good for your patients. So missed doses, when patients miss their doses of medications, this can also lead to drug resistance. And so again, be thinking about patient teaching. All this is going to be a part of your patient teaching about adherence to the drug treatment regimen. Missed doses does lead to lower drug levels, therapeutic levels in your patient's system. So then what happens is that there's not enough drugs to suppress replication. And then this leads to new HIV particles that are produced, and they become resistant to the drugs. Once a resistant mutation occurs in the body, the resistant virus is stored in the body indefinitely. All right, so the body will always know that that there is this resistant virus, and what we call that is, or we refer to this as archiving. And so basically the resistant drug cannot ever be used again, all right, because it's archived, it's present in the patient's system. And if you try to give this patient this drug that they're not resistant to, it is not going to be effective because again, it is present. Our system knows that we are resistant to that particular medication. All right. I want you to also look at page 350, chart 19.6. It talks about the main actions of each drug category along with its drug. Now, the big drawbacks of CAR therapy are expense. It's very expensive. Also, food, because some of these medications you have to take them with food, and sometimes these patients, from a socioeconomic standpoint, they don't have adequate nutrition. Also, timing requirements and the number of daily drugs. Remember, this drug therapy is lifelong and is oftentimes burdensome for these patients. So to try to keep up with this daily regimen for the rest of your life be quite the daunting task for them. Now, these drugs have a significant side effects, and there are many drug interactions as well when these patients take this combination CART or this CART therapy. All right. I want you to also read about, it's on page 353, read about the concept immune reconstitution inflammatory syndrome, or IRIS is the acronym that is used. And it essentially speaks to how the immune system is reborn again. and has the ability to recognize opportunistic infections now. And after so long of taking this medication, the immune system is anew again and is able to fight off any infections. It's a phenomenon that I have never heard of in my professional career, but I understand this is a phenomenon that is real. Now, we want to also ask these patients if they are receiving any complementary and/or integrative forms of care, as some therapies may interact with HIV drugs. So you want to consult the pharmacist if you suspect the potential for drug-herbal adverse reactions. All right. Antibiotics can upset also the natural balance of good and bad bacteria in the bowel. And so when these patients are on antibiotics, it can lead to a condition called C. difficile. And so this is a common cause of antibiotic-associated diarrhea. Right. So what happens is that they can cause a severe diarrhea and an infection called pseudomembranous colitis. And many people get this infection actually after they stay in the hospital for a certain period of time or nursing facility. And so when it is expected that a patient has C. difficile, stool cultures should be obtained to ensure patients have not developed this super infection, such as, again, a C. difficile infection. All right, and so the next priority issue that we will discuss is enhancing gas exchange. And of course, there's some drug therapy involved here. There's respiratory support and maintenance, comfort, rest, and activity changes as well. A common respiratory issue is PCP, or pneumocystis carinii pneumonia. And drugs that are used to treat this condition is Bactrim, pentamidine, bronchodilators, dapsone as well, etc. So there's some additional medications that you should be looking at. To see more drugs in this particular section, also read page 353. Read about their side effects as well. Now, the drug pentamidine, patients on this drug should have their liver function, their liver enzymes checked, as well as their platelets and their sodium levels, because this drug can impact your electrolytes, your blood system, and your liver. We want to also monitor the patient's respiratory status, observe for cyanosis. Respiratory therapy is also consulted, etc. Also, we want to pace activity so as not to create more fatigue for these patients, as well as shortness of breath. We want to ensure that the patient is breathing, that their breathing is comfortable, especially patients with PCP pneumonia. And so we want to ensure that the patient is well rested in order to be able to participate in meal times. You don't want them to be so exhausted that when it's time for them to eat, they're exhausted. So you want to balance that rest with activity that I always talk to you all about. All right, and so the next priority issue is pain, managing pain. And so what is significant here is that we are providing comfort measures. Drug therapy is also involved here, as well as complementary and integrative therapies. Now, the pain can be caused by enlarged organs that are now stretching the viscera, or they can be compressing on nerves. With these patients, their organs are enlarging, and so that stretching of that organ is what it's referring to. And again, as I just mentioned, the size of these organs are becoming so large they're now beginning to compress the nerves, causing more pain. There is also tumor invasion of the bone and other tissues can cause pain. Compression of nerves from swollen lymph nodes too can cause pain as well. These patients also experience peripheral neuropathy, and this induced pain from the disease itself, the HIV disease, and or drug side effects. These patients are typically prescribed gabapentin that is used to essentially manage the neuropathic type of pain these patients experience. Also read expected outcomes for pain on page 353. Comfort measures involve pressure relieving, providing the patient with a pressure relieving mattress pads, also providing warm baths, and there's also some more additional information there I would like for you to read. Also, we want to use sheets to avoid pulling and grasping on this patient's joints, which can cause the patient some pain. So we always want to assist these patients with change in their positions because they're so fatigued and just tired and weak that they can't do a lot of this on their own. Other medications that are used for pain are NSAIDs, Lyrica, Elavil, and many of these medications actually deal with the neuropathic pain that these patients are receiving. They also use anticonvulsants such as Dilantin or Tegretol in particular. They are used to control this neuropathic pain as well. But they can take several days to weeks before the effects are seen. So this must also, you must also teach this to your patients as well. Also read the rest of the information on the drug treatment on page 354. Opioid uses involve hydrocodone as well as morphine for severe pain. Now, a combination of using a weak and a strong opioid should be used in order to provide more sustained pain relief. So you may have to combine both the weak and strong opioid. I also want you to look at page 354, complementary therapies. Under the pain section, and it talks about the acupuncture, biofeedback, etc. So go ahead and read the rest of that information as well. The next priority issue is enhancing nutrition. And this speaks to drug therapy, nutrition therapy, as well as mouth care. So good nutrition helps AIDS patients maintain their weight and nutritional status. Weight gain is a good indicator that the patients who have wasting syndrome are improving due to adequate nutrition. These AIDS patients, they do experience wasting syndrome, where they're just losing so much muscle mass and just wasting away. Nutritional issues can be caused by these patients being overly fatigued, they're anorexic, or they have anorexia. They also experience nausea, vomiting, and diarrhea, and I have this abbreviated as N-V as in Victor, -D as in David. This is how we document this in the clinical setting, etc. And also read the rest of that on page 354. Read also expected outcomes along with indicators such as maintaining normal blood levels of ferritin. This lets us know that the patient's nutritional status is improving. So you're checking to see if they have normal levels of ferritin and also albumin. Remember albumin being your proteins, etc. Read the rest of that. These patients also have swallowing problems associated with candida esophagitis, which can impact their nutrition. Drugs for treatment of candida esophagitis that can be used is diflucan, PO, or IV amphotericin B. Amphotericin B. And so you also want to observe for side effects for these medications as well. We want to also provide mouth care. Mouth care can improve the patient's appetite. These patients should also be given ice chips or cool drinks. We want to also avoid any unpleasant odors in the patient environment. For example, if a patient has a bedside commode at the bedside, and after they use it, you want to go ahead and empty that as soon as possible, because that unpleasant odor can also impact their desire to eat. We want to also avoid alcohol-based mouthwashes. We should be washing or rinsing the mouth with sodium bicarb with sterile water or normal saline instead. We want to also use a soft toothbrush. We can use an oral analgesic gel. And the UAP, the unlicensed assistant personnel, they can perform many of these tasks. These patients are also prescribed antiemetics prescriptions like your Zofran, Phenergan, and what have you. As far as the type of diet, these patients require a high-calorie, high-protein diet, help them with their weight loss. We want to avoid any dietary fat due to fat intolerance from AIDS and the side effects of your antiviral medications. We want to also provide these patients with small but frequent meals, because they can tolerate small meals better than the large breakfast, lunch, and dinner. So make sure you break them up over the course of the day. 2 feedings in TPN might be needed if the patient is not able to maintain nutrition orally. So keep that in mind as well. The next priority issue is restoring skin integrity. Here we want to minimize diarrhea by providing antidiarrheals. Keep the perineal area clean and dry as well. As far as restoring skin integrity, antiretroviral drug therapy might be given for a treatment of Kaposi sarcoma. That's what the KS is. It's a form of skin cancer that we should discuss in the live meeting. Also, analgesics and comfort measures are provided, as well as appropriate skin care. All right. I want you to read the expected outcomes along with indicators such as maintaining control of stool or fecal passage and absence of new lesions or open skin areas, etc. So go ahead and read that section. We may provide antidiarrheals such as Lomotil and Imodium. This helps to decrease diarrhea. In order to reduce diarrhea, we want to avoid certain foods, like you want less roughage in the diet, less fat, and spicy foods as well. And there's some additional information there for you to read. If antiretroviral drug therapy um, is ineffective in treating Kaposi sarcoma, these patients might, because this is a cancer, so these patients may require radiation treatment and perhaps systemic chemotherapy, etc. These patients might need analgesics for pain relief as well. Good skin care for those with herpes simplex virus might need to be treated with antivirals like Zovirax, ZO V as in Victor, IRAX as in X-ray. All right. If these patients have an abscess on the skin, these should be cleansed at least once per shift or more if possible. It might be necessary. And that can be cleansed with a saline solution. Your UAP should be able to perform that task as well. And also there's a medication called modified Burroughs solution. And this solution is also with a dressing. It's like a liquid solution that you pour in dressings and you wrap around the wound. And it does promote wound healing. All right. The other priority issue is enhancing cognition, because remember, these patients, their cognitive capacity is also impacted by this disease. We want to reorientate these patients to person, place, and time. And the interprofessional team should be involved in this effort. I said in this effect, but it should be in this effort. You should be providing simple instructions and directions so that they're better able to follow them. We want to also move the patient's bed close to a window if possible, because this will also help with their orientation status. Drug therapy is also used to treat different conditions contributing to confusion. These patients might be prescribed psychotropic drugs used to treat behavioral and emotional disorders. Safety measures are also important here. Assist these patients with their activities of daily living, or ADLs, like bathing, feeding. We want to also observe these patients for increased intracranial pressure. I have here written PSI. PSI means pressure. So we want to observe for increased intracranial pressure, such as confusion, etc. So take a look at the rest of the information there, and provide support for these patients. These AIDS patients, they do experience neurological changes and confusion. It can be due to organic disorders, infections, cancer, etc. Read the rest of that on page 355. Read also expected outcomes along with indicators such as improving mental status, and associated indicators such as identified self. They should be able to identify themselves as well as significant others, etc. Always get a baseline neurological mental status so that you know when changes have occurred and how severe they are. As far as support is concerned, family members are vital to this patient's care. We want to teach the family to reorient the patient, and also to provide these patients with current event kind of information. And there's some additional information there for you to read as well. All right, and now we want to address the psychosocial distress issues with these patients. HIV patients have many issues leading to psychosocial distress, such as depression, anxiety, fear, isolation, and loss. Family members must be taught that the patient's infection is the problem, not the patient, and should be encouraged to see their loved one in order to avoid any feelings of isolation. We may want to also have a mental health professional involved with the care team, the interprofessional team. This is vital to the patient's mental health. Um, Being supportive, honest, caring, and open to the patient's thoughts and feelings can address the psychosocial issues as well. We want to also assess these patients for suicidal ideation and communicate this to the interprofessional team. So we always want to think about providing a climate of acceptance, promote a trusting relationship. We want to encourage these patients to express their feelings, identify positive aspects of the self. All right, can't always be focused on the negative. Allow for privacy, but yet avoid isolation. I think we all like some privacy from time to time, but you don't want it to the extent where the patient feels isolated. We want to also encourage self-care, independence, as well as control. All right, this helps the patient's self-esteem, if you will. We can also use certain treatment modalities such as guided imagery to help the patient to deal with their psychosocial distress. And also, one of the biggest and most important interventions you can do here is be a good listener. As far as care coordination and transition management, and so this talks about home care management, self-management, education, psychosocial preparation, and healthcare resources. Read page 356, chart 19.7. Talks about the focused assessment for patients with AIDS who are in the home setting. Just helps you to focus your assessment better. So go ahead and take a look at that. Arrange for assistance at home if the patient is too debilitated and weak to care for themselves. These patients are entitled to a home care aid in many cases. We may also need to help these patients with referrals for outside resources such as finances, home placement. They have here locally the Rainbow Clinic at Shands UF. You can also consult with a social worker who has an array of resources that they can provide for you, for the patient. As far as self-management education, we must teach these patients about the mode of transmission of infection and also prevention strategies. Teach them about self-care strategies. These patients must be also taught to avoid raw or rare fish, fowl, which is a bird, certain birds, and also other meats, if you will. Thorough hand washing is paramount here. Washing the fruits and vegetables also can help minimize any future infections, etc. So read the rest of that information. Also see chart 19-4 about how to avoid infections. As far as the psychosocial preparation, help patients with coping strategies to deal with the stigma and rejection of those infected with AIDS. And again, referring them to a mental health provider would be very useful here. We want to also encourage these patients to participate in usual or past activities, kind of get back to their old routine. Would be encouraged. We want to also refer these patients again to appropriate mental health and social services. As far as healthcare resources, social services can assist the health team in appropriate resources like respite care, housing, clinic services, etc. That's about it for care coordination and transition management. And I think this is the last um, slide here, evaluation. Other expected outcomes include, but are not limited to, adherence to prescribed drug therapy regimen at least 90% of the time, practice safe sex techniques at all times, remain free of opportunistic infections, etc. And look at page 357 under evaluation reflecting for additional information. So the overall outcome for care patients with AIDS are to maintain the highest possible level of function for as long as possible, to reduce infection, to maintain a good quality of life and dignity during the course of progressive illness.